Healthy-ojas.com. Vital information for a healthier life.
Welcome to this video on coronavirus, SARS CoV-2 virus and COVID-19. Before going into the details, I request you to please subscribe to this channel by clicking the red subscribe button once and pressing the bell button next to the subscribe button. In this episode, I am trying to answer few COVID-19 questions. What is a coronavirus? List of coronaviruses affected the human. What are the symptoms of COVID-19? Who are at higher risk towards COVID-19? The structure of SARS CoV-2 virus. How SARS CoV-2 virus enters the body and causes COVID-19. How long does the virus survive on different surfaces? How useful the face mask to prevent COVID-19? How are COVID-19 diagnosed? What are the treatments available for COVID-19? What are the complications of COVID-19? How can you prevent COVID-19 infection? What is a coronavirus? Viruses are microbes that can infect cells. Once they attach on a cell, they use cellular components to replicate and infect more cells. Corona is a Latin word that means crown. The coronavirus has crown-like spikes on the outer surface, thus called as coronavirus. Coronaviruses are a group of viruses that cause infection in animals and or humans. In humans, most coronaviruses cause respiratory conditions from the common cold to severe disease such as acute respiratory syndrome. List of coronaviruses affected the human. There are about hundreds of coronaviruses. Out of these, only 7 can infect humans. Out of these 7, 4 causes mild symptoms and the other 3 causes serious illnesses. 4 human coronaviruses that cause mild to moderate symptoms are 229E, NL63, OC43, HKU1. 3 coronaviruses that cause severe risk to human health are originated from animal infections and eventually transmitted to human. They are SARS-CoV, Severe Acute Respiratory Syndrome. SARS coronavirus appeared in southern China in November 2002. SARS-CoV may be originated from bats that infect other animals before causing human infection. During 2002 and 2003 epidemic, more than 8,000 people in 26 countries around the world contracted this virus and 774 reported deaths. MERS-CoV, Middle East Respiratory Syndrome, MERS coronavirus emerged in Saudi Arabia in September 2012. MERS-CoV human infection was through contact with infected camels. Since 2012, there are more than 2,400 cases reported in 27 countries, the majority of them from Saudi Arabia. SARS-CoV-2, Severe Acute Respiratory Syndrome, SARS coronavirus 2 outbreak was in Wuhan, China in December 2019. The origin of the virus is claimed to have linked to the seafood and poultry market. However, its exact origin is highly controversial and unknown. Within a short period, that is, in a few months, SARS-CoV-2 has spread to more than 213 countries around the world. The SARS-CoV-2 virus causes disease COVID-19. CO stands for corona, VI stands for virus, D stands for disease, and 19 stands for the year 2019. The World Health Organization (WHO) got the initial report about COVID-19 from the Chinese government on December 31, 2019. WHO announced it as a global health emergency on January 30, 2020, subsequently as a worldwide pandemic on March 11, 2020. Compared to SARS-CoV and MERS-CoV, the SARS-CoV-2 virus exhibits faster human-to-human transmission. What are the symptoms of COVID-19? The symptoms of COVID-19 are dry cough, low-grade fever, tiredness, shortness of breath, sore throat, nasal congestion, chill feeling, aches such as head, muscle and body pain, gastrointestinal problems such as nausea, vomiting and diarrhea, trouble breathing and excessive drowsiness. Those with diabetes, high blood pressure, heart and lungs problems or cancer and older individuals are at risk of developing a severe illness. Who are at higher risk towards COVID-19? Some occupations could increase risk towards COVID-19. They are How often and close does the job expose us to the infection? Infection rates are higher among healthcare professionals and workers such as doctors, nurses, paramedics, and other hospital staffs. Sanitation workers in the hospital and other places are also at highest risk. What extent does the job require to perform the task in close physical proximity to others? Hairdressers and personal care aides are also have a higher risk of infection because of their close proximity to the number of people. How much does the job require contact with others to perform their duty? Police personnel, firefighters, bank staffs, supermarket employees, and mercantiles are at risk due to exposure with several peoples. The structure of SARS CoV-2 virus. SARS CoV-2 has 4 structural proteins. They are S. Spike, E. Envelope, M. Membrane, and N. Nucleocapsid proteins. The N protein carries the RNA genome, and the S, E, and M protein all together form the viral envelope. The spike-like protein on the surface of the SARS CoV-2 virus bind to the ACE receptor. It is like a key inserted into the lock before it enters and infects the cells. After attachment with the host body cell, the genes of the virus RNA enters the host cell and forces the cell to produce and release copies of the virus infect, which in turn infect more cells. ACE2 is present in many cell types and tissues, including the lungs, heart, blood vessels, kidney, liver, and gastrointestinal tract. Some evidence suggests that ACE2 may be higher in patients with hypertension, diabetes, and coronary heart disease. How SARS-CoV-2 virus enters the body and causes COVID-19. The infection spreads primarily from person to person through droplets from the nose or mouth while cough, sneeze, or speak. People get infected if they breathe in these droplets from an infected person. That is why it is essential to wear a mask and to maintain a social distancing to prevent in contact with these droplets. Stage 1. Asymptomatic state. The inhaled virus likely bind to the epithelial cells in the nasal cavity and start replicating. In this stage, the infected person acts as a carrier and unknowingly can infect others. Stage 2. Mild symptomatic state. The virus propagates and migrates down the respiratory tract along the upper airway and conducting airway, and an innate immune response is triggered at this stage. For about 80% of the infected patients, the immune system responds in time by generating antibodies to destroy the virus. Thus, the disease will be mild and restricted to the upper and conducting airway. Stage 3. Severe symptoms due to ARDS. Unfortunately, about 20% of the infected patients will progress to lower respiratory infection, virus infecting their lungs. At this stage, the immune system invokes a vigorous response that produces more harm than benefit. That is, it causes inflammation and liquid accumulation in the lungs. Acute respiratory distress syndrome is a respiratory failure characterized by inflammation in the lungs. A case report in Wuhan from 99 COVID-19 patients confirms that there is an increase in inflammation markers such as neutrophils, interleukin 6, IL-6, and C-reactive protein by about 38%, 52%, and 86% respectively, and 35% decrease of total lymphocytes. Reference Lancet 2020, 395. This vigorous immune response is detrimental to the patient and produces severe symptoms. How long does the virus survive on different surfaces? The droplets from an infected person can be on the objects such as tablets, mobiles, doorknobs, and handrails through the air or by hand. People can get infected by touching these surfaces, then touching their eyes, nose, or mouth. That is why it is essential to wash hands frequently with soap and water or clean with alcohol-based hand rubs. The coronavirus can live for hours to days on different surfaces. How long it survives depends on the material of the surface. On the metal and plastic surfaces, it can survive up to 2 to 3 days. On wood surface, it can survive up to 4 days. On a paper and glass surfaces, it can survive up to 5 days. On a cloth surface, it can survive up to 2 days. Reference Stability of SARS-CoV-2 in different environmental conditions, published in the Lancet Microbe, April 2, 2020. How useful the face mask to prevent COVID-19? When a person cough, talk, or breathe, there is a release of 900 to 3 lakh liquid droplets from their mouth. The size of these liquid droplets is microscopic, which is a thousandth the width of the hair. While coughing, the particles can travel at a speed up to 60 miles per hour. People with coronavirus with or without symptoms can transmit the virus to others. Thus, to protect from these infected droplets, we need to maintain a distance of 6 feet, 1.8 meters from others. But it is not always possible to maintain distance gap between individuals, especially in a shopping mall, bus, train, etc. So, for complete protection, we need to wear a mask. Study shows wearing a mask can prevent the virus from getting into the body. Reference: Infectious Disease Modeling 2025. How are COVID-19 diagnosed? The diagnosis of COVID-19 is through saliva or nose swab. This test uses a cotton swab to retrieve a sample from the inside of your nostril and throat. Also, there is another test available by testing your blood for the presence of antibodies. Consult your doctor immediately if you think you have COVID-19 or you notice any symptom. What are the treatments available for COVID-19? At this time, May 2020, there is no specific treatment for COVID-19 and no cure for it. Generally, treatment is based on the symptom to ease it. Seek medical care if you think you have COVID-19. Your doctor will recommend proper treatment based on the symptoms or complications that it develops. Some standard treatment used for this infection include antiviral or retroviral medications, ventilator to support breathing, steroid to reduce lung swelling, blood plasma transfusions. Caution: do not self-medicate, that is dangerous, so consult your doctor. What are the complications of COVID-19? A study of 138 people admitted to hospital in Wuhan, China found 26% of those admitted had severe cases who need treatment in an intensive care unit (ICU). About 4.3% of these people who admitted in the ICU died from pneumonia. Reference: JAMA 2020 323-11. Please note, the people who admitted to the ICU were on average older and had health problems compared to others who did not need the ICU treatment. Researchers noted the following complications in 4.3% of the patients: acute respiratory distress syndrome (ARDS), irregular heart rate, arrhythmia, cardiovascular shock, severe muscle pain, myalgia, fatigue, and heart damage or heart attack. How can you prevent COVID-19? The optimal way to prevent the transmission of this infection is to avoid contact with infected people, practice personal hygiene and physical distancing. Below are some common prevention tips. Stay at home. The best way to protect yourself from the virus infection is to avoid its exposure, that is, staying at home to avoid contact with people who might have the virus infection. Wash hands often. Frequently washing your hands for at least 20 seconds at a time with water and soap or alcohol-based hand rubs to remove virus infection. Wash your hands before eating, after visiting the toilet, and after back home from outside. Maintain respiratory hygiene. Avoid placing your hands in the nose, mouth, eyes or face. If you want to do so, do only after washing your hands. Wear a mask. If you feel sick such as cold or flu symptoms, don't go out. If you need to go out, wear a mask to prevent virus transmission to others. Practice social distancing. If you need to go out from home, maintain social distance, primarily if the community is infected. It is best to stay at least 6 feet, 1.83 meters, away from others. Maintain social hygiene. While you sneeze or cough, cover your mouth with a tissue or the inside of your elbow. Properly dispose of the tissues or mask in a closed dustbin. Disinfect. Clean and disinfect objects that you touch a lot, such as phones, computer, utensils, dishware, doorknobs, etc. In short, avoid unnecessarily going out, always wear a mask while going out, maintain social distancing, and often clean your hands. It is useful not only for your well-being but to the entire community. Join hands to fight COVID-19 to protect the human community. That's all from today's episode. I hope I have answered most of the questions in your mind. If I missed any of the questions, please ask your question as a comment. Surely I will try my best to answer it. My humble request to all, Please like and share this video as much as possible. It motivates me to make more informative video for you. I request you to share your thoughts and questions as comment. I will read every comment and answer your questions or take your suggestions. If you want more video from me, please subscribe to this channel by clicking the red subscribe button once and pressing the bell button next to the subscribe button. Thank you for watching this video, and I will meet you soon with another good video. Until then, goodbye.